All right, YouTube is live, you guys.
Good morning, T. How are you doing?
Good. Good. How are you?
I'm well.
Good.
Yeah.
Just for context, that's a current list of the suggestions from people.
All right. I thought you had to be away today.
No, just yesterday.
Okay.
Living the apartment life again.
Good morning, Christine. Good morning, Sonia.
Very punctual group here. They're all coming right in at the top of the hour. We'll give just a few more minutes to see if we can get critical mass for a quorum.
And Andrew, I see that Dr. Welch is on the Zoom, and Lauren has his presentation uploaded. Hey, Dr. Welch. And Lauren will share her screen when it's time for him to present.
Great.
Dr. Welch, we know you're on a tight timeline today too, so we'll move rapidly to your presentation and understand that when you've got to drop off and head on to other activities, that's fine. So good. Thank you for joining us. I know my co-chair was expecting some delays this morning too, so she's multitasking, but will join us at some point, I believe. So Andrew, just take note of that, and we'll anticipate that she'll join. And if that's helpful in a quorum or such, then
We have 9 now, which means we can start knowing that Terry will make the 10th.
excellent.
So I'll start. Good morning. I'm Andrew Doss. I am serving as the director of the Resilient Louisiana Commission. Welcome to this Friday, October 2nd meeting of the Commission. It is now called to order. I'd like to thank all the Commission members taking part. I'd also like to thank and welcome members of the public. Public's attention and involvement is crucial to the success of the Commission. The Resilient Louisiana Commission appreciates your invaluable input. We welcome your continued participation and insight. This meeting is available via YouTube, and members of the public are encouraged to provide comments at resilientlouisiana@la.gov. The public can sign up for meeting email alerts and access Resilient Louisiana Commission and Task Force meeting schedules, agendas, minutes, audio recordings, reports, and other documents of interest at opportunitylouisiana.com/Resilient Louisiana. At this point, we'll conduct a roll call. First, I'd like to recognize that I do see the following Commission members present: Secretary Don Pearson, Secretary Kimberly Lewis Robinson, Dr. Jim Richardson, Scott Henskins, Bill Hogan, Walt Leger, T. Martin, Sonia Perez, Jay Brown Russell, and Terry Sterling will be joining us momentarily. Are there any other members? Is Commissioner Jay Darden here? Representative Paula Davis, Senator Ronnie Johns, Lieutenant Governor Nungesser, Michael Lafitte, Tyron Picard, Louis Wren, Tim Temple.
Tim Temple's here.
Great. Okay, with 10 present, we have a quorum. In accordance with revised statute 4217.1, this notice shall serve as certification of the inability of the Resilient Louisiana Commission to otherwise operate in accordance with the Louisiana Open Meetings Law due to such a meeting being detrimental to the health, safety, and or welfare of RLC members and the public as a result of the public health emergency, as declared by Governor John Bell Edwards. The RLC will provide for attendance at its essential meeting today via video conference because it is unable to obtain a quorum in person. Now, if everyone could please mute themselves for the remainder of the meeting, I'd like to introduce our 2 co-chairs. Well, actually only Secretary Don Pearson, who is the Secretary of Economic Development. Healthcare Management Advisory Consultant Terry Sterling will be joining us later. Secretary Pearson, I hand it over to you.
Good morning, everyone. Thank you for the introduction, Andrew. And just really quick on the housekeeping side, we are tracking the example set by the Board of Regents. And so there's a mirror image YouTube executing right now, but due to some of the interruptions posed to public discourse in the past, it's a security measure. So if you notice that maybe we don't have the large number of attendees that we typically have in an RLC meeting, just know that the public's being fully informed and aware of all the conversations and information exchanged today. And so that's a good thing. We have a great agenda. You may have had a chance to review it, but we want to move it right along because Dr. Frank Welch is with us today, the medical director for the Louisiana Office of Public Health Immunization Program. I think we're all aware that somewhere out there on the horizon, there's a vaccine being developed. And at some point in time, that vaccine will be available. Well, so what happens then? How do we embrace the execution of getting the population of Louisiana vaccinated? So there is a team working on that. That's good to know. And Dr. Welch is a leader in that. We're going to allow now to pass the microphone over to Dr. Welch. And we also have his presentation queued up. And he'll notice us on advancing the slides. Thank you. Dr. Welch?
Thank you for having me. Andrew or Dawn, can you hear me? Thumbs up?
Loud and clear.
There we go. Excellent. Thank you so much. And thank you to the Commission for having me today. I apologize for only being available for a short time, but I am with you here for about 35 or 40 minutes just in case anybody has any questions. I think especially at this time and with what we've heard about the vaccine so far, it's important for people to be educated and be able to ask questions. Lauren, if you could post that, there we go. So what I'm going to do today is just brief you on the state's preparation for conducting a vaccination campaign. I am not in charge of making a vaccine, conducting clinical trials, approving vaccines or disapproving them, but I do have some knowledge about those things. But really what my job is to take an approved, effective, safe and effective vaccine from the FDA and the CDC and help present that to the citizens of Louisiana. Laura, next slide. So I'm going to talk about a few things today. How vaccine safety will be evaluated, Operation Warp Speed, which is the federal program for a vaccine, and I don't love that name, by the way. The Vaccine Action Collaborative that we've established in the state of Louisiana, how we're actually going to allocate and receive the vaccine in Louisiana, how we're going to distribute it, who the priority groups, the initial priority groups may be, how we're going to account for every single dose of the vaccine, who's actually going to administer the vaccine, and then how we're going to communicate not only about the vaccine, safety information, what you need to know about the vaccine, but if any problems arise, how we're going to communicate that as well. So next slide. So vaccine safety is going to be evaluated. There's actually needs to be 4 triangles on this. First by the Food and Drug Administration, the second from the Advisory Committee on Immunization Practice at the Centers for Disease Control, and then there is an independent body called the Vaccine and Related Biologic Products Advisory Committee, and they are a group of people not associated with government. They are university scientists, researchers, who independently write reviews, look at clinical trials for vaccines, and come up with information on vaccine candidates, including benefits and risk, and they make recommendations regarding approval of vaccine. So I get a lot of questions on that initially. Do we approve or disapprove vaccines within the state? Now, the governor may, in fact, as we move forward, have his own independent body within Louisiana of scientists to take a look at the data and the information on vaccine safety as well. Next slide, please. Operation Warp Speed is the federal program that you have all heard about. They aim to deliver 300 million doses of a safe, effective COVID-19 vaccine by January 2021. I think we might be a little off on that scheduling. We do not yet have a vaccine candidate, nor do we know when one will be available. However, Operation Warp Speed is a joint federal partnership, including HHS, the CDC, the Food and Drug Administration, the National Institutes of Health, and again, the Biomedical Advanced Research and Development Authority and the Department of Defense. Operation Warp Speed engages with private firms, drug companies, basically, and other federal agencies to coordinate HHS-wide efforts, including the NIH Accelerated COVID Therapeutic Inventions and Vaccine Partnership. We do believe that possibly by a year from now, we may have between 8 and 16 COVID-19 vaccine candidates in the United States. Next slide, please. So in Louisiana, we actually formed what we called the COVID-19 Vaccine Action Collaborative, and this was way back in June. We have been planning for the receipt and distribution of COVID-19 vaccine, for about 3.5 months. Even though Operation Warp Speed and the CDC just put out their criteria about a week ago, again, we have been planning for 3.5 months. Our goal is to plan for the equitable and organized receipt and distribution of COVID-19 vaccines in order to reduce the spread of the virus and reduce comorbidity and death in vulnerable populations. We have extensive membership within the Vaccine Action Collaborative. Sometimes I get questions. This is different than the governor's COVID-19 Health Equity Task Force, although we work very, very closely with that group as well. Again, it was formed in June. We have more than 50 members in 4 subgroups. Again, this isn't really the exciting part about what people read about vaccines, whether they're safe or not, and who made them or not, and what the clinical trials do. What these subgroups do, they're communications, logistics and operations, planning and prioritization, But there used to be a fifth subgroup called health equity. But what we've decided to do within the state of Louisiana is we have health equity participation on every single one of these subgroups. So it's not its own separate subgroup. We have health equity operating within the 4 subgroups. And then we have members of the governor's health equity task force on every single subgroup as well. Next slide, please. So the goals of the Vaccine Action Collaborative within Louisiana. We need to communicate about the vaccine with stakeholder guidance. We need to identify, define, and estimate the number for vaccine priority groups within the framework of national guidance. And what I mean by that, most people don't realize that vaccines are actually made in batches. They're not made all at once. And then again, we have multiple different drug companies making different vaccines. And so we will not get a whole bunch of vaccine initially. In fact, we expect to get a very small amount of vaccine when the first company does finally release a safe and effective vaccine. So then you have to decide, well, who gets it? Who gets these first initial doses? And then as we go through the months and more vaccine candidates are approved and these companies continue to make more and more of their vaccine, it will become more widely available. So we really do need to look at these vaccine priority groups and find out who they are, find out where they are, find out how many people there are in each one, and find out how we can contact them and how they're going to be vaccinated. All of that planning has already begun. Second goal of Vaccine Action Collaborative is when we do get a vaccine in Louisiana, we need to immediately allocate that. We do not want it to sit on the shelf at any point. Several phases of prioritization of those initial vaccines, we do expect that. We will use our existing process for distributing vaccines within the state of Louisiana, and I'll go through who those vaccinators are. But again, we're also planning with alternate and contingent planning because there's multiple ways that these vaccines may come to the state of Louisiana. This next bullet refers to what we call the cold chain. Remember that at the time a vaccine leaves a drug company warehouse to the time it is administered in someone's arm, we do need a very careful process of how that vaccine is stored and handled. That's called the vaccine cold chain. And there's a very strict process that needs to happen during that timeline. We're planning on that as well. But then, of course, we need to securely dispense an effective vaccine using hospitals, doctors, pharmacies, public health units, federally qualified health centers, closed and open pods, and I'll tell you what that means in a minute, and also our mass vaccination partners to make sure that those citizens who do want to get the COVID-19 vaccine within Louisiana, when their priority group comes up, have that vaccine available to them. We also need to collect and depict data throughout the vaccine response to inform our decision making. Who got the vaccine? Who didn't get the vaccine? Are there pockets of need? Do we see problems with this vaccine within Louisiana? We need to collect and inform that data and also communicate that as well. Next slide, please. So vaccine allocation, what that means is when you get when the federal government tells us that there is vaccine available, where do you send it to? We will work within the national framework and priority populations. That federal framework actually comes out this afternoon in about 2 hours. What they're going to do is in kind of broad sense and then a little more defined, tell us exactly who they think should get the first doses of vaccine. One thing that some people don't understand, and I certainly didn't understand before I took this job, is there won't be just a COVID vaccine. There'll be 8 or 9 COVID vaccines, and each of these companies that has produced a vaccine has different what we call indications. For example, they may have tested their vaccine on young adults and adults, say from age 18 and older. They may have tested it on children 11 or older. They may have only gone up to age 55 and not up beyond that. So each vaccine is actually going to have its own indications. I mean, you can't necessarily give each vaccine to any given person. And the best example I can give you of that is when we planned for the H1N1 vaccine campaign in Louisiana, remember that those first people who were going to get the H1N1 vaccine were at-risk adults, those people with comorbid conditions like diabetes or lung disease or something like that. And it turns out the first vaccine we got in Louisiana was a pediatric vaccine for healthy children. It couldn't be given to adults. It could not be given to people with high risk. So we really need to make sure that we understand all the indications and make sure, you can imagine that's basically a communication challenge. We want to make sure that we communicate to people what the indications for each vaccine are and how that fits within the priority groups within Louisiana. Now, there's an interesting thing about these vaccines as well. the White House and the CDC are actually working specifically directly with some groups as well, not through the state, but directly to some groups, possibly pharmacies, to distribute vaccine directly to some populations. One that we've definitely heard about is that the federal government may partner directly with a pharmacy like Walgreens or Albertsons to directly vaccinate all nursing home residents and staff. As you know, nursing home residents and staff are one of the highest populations that we've seen illness and death in. So it's a very important population to identify. That vaccine may go directly to a pharmacy to those locations and not come through the state. We don't have much information on that yet. So our number one priority within the Vaccine Action Collaborative currently is taking this very long list of priority groups within the federal framework and identifying who those populations are, how many of them are, where would we locate them, and how would they be vaccinated. Most of this vaccine is actually on that second part of that slide is going to go through a company called McKesson. And so the state won't actually be handling much vaccine ourselves, meaning my office will not get a big package of vaccine and I'll have to divvy it up and send it out. In fact, the job is going to be mostly on computer. Those people who have signed up to be vaccinators, we will allocate that vaccine and send it directly from McKesson directly to the vaccinator. There may be some small role of the state there. When we get further along into the campaign, you can imagine a doctor's office or a place that only wants 30, 40, or 50 doses of vaccine. We may play a role in directly distributing that vaccine to those small vaccinators, but the majority of the vaccine is going to go directly from the storage warehouse, McKesson, directly to the person who's going to be vaccinating other people. Next slide, please. So vaccine distribution, again, I just described most of that. Most of it is going to go directly to the person doing the vaccinating. Small orders later in the campaign may go through the state. And again, there may be targeted delivery to some populations. We've heard different things. There may be direct distribution to nursing homes, maybe direct distribution to hospitals themselves, maybe direct distribution to correctional facilities. And there may be direct distribution possibly to some of those places we've heard where they've had those big outbreaks, these big processing centers, say, for example, for poultry or for vegetables or things like that. Those places may be directly contacted through Operation Warp Speed and get vaccine directly. Next slide, please. So who is going to make recommendations for this vaccine? Each of these vaccines will come out under the heading of the FDA and the ACIP, the Advisory Committee on Immunization Practice. The initial framework, and again, I'm going to get a detailed framework in a couple hours here, but they have put out an initial framework. And the initial guidance for those first few doses of vaccine is going to go to the critical workforce, and those are healthcare workers on the front line treating known coronavirus patients every single day. To make sure they're protected and maintaining that healthcare capacity. After that infrastructure workforce, then persons at highest risk for severe outcomes will also be prioritized. And I'm going to show you a broad framework of that. Again, we want to make sure in Louisiana that we maintain equity with this vaccine as well. There are some populations and some careers and some occupations that put someone at higher risk for getting coronavirus, and we want to make sure that they are focused on as well. Again, the framework for the equitable allocation of COVID-19 vaccine will come out this afternoon, and again, it has two main goals: reduce transmission of COVID-19 and reduce morbidity and mortality. Next slide, please. So this is just really broad. Just know that the spreadsheet we have for each of these phases is very, very long. This is broken. This is just a very general picture of the work that we've already done. But the federal government has us planning in 4 phases. You can see in phase 1A is the jumpstart phase. This is when we have very little vaccine and we have to decide, who is on the front line to get these first few doses of vaccine. And one of the other challenges with this vaccine that I didn't mention is the vast majority of the vaccine candidates actually require 2 doses to be protected, meaning you need a dose today, and then you need another dose, say 21 or 28 days from now. And the challenge with that is currently within the United States in our prescribing framework, you can't mix and match. You can't get one type of vaccine today and then a different type in 28 days. You can imagine that's going to present us with a huge challenge. You have to get the same vaccine. And then when I say between 21 and 28 days, that's because each vaccine has that different interval between doses. So in phase A, we're going to have the jumpstart phase. And these are the healthcare workers, high-risk workers, and first responders who we know are going to encounter COVID-19 patients every single day, EMS drivers and things like that. Phase 1B is going to be people of all ages with comorbid and underlying conditions that put them at significantly higher risk. This is nursing home residents and people with severe medical conditions as well. And of course, older adults living in congregate or crowded settings. In phase 2, this will be critical workers, workers who are both in industries essential to the functioning of society and at substantially higher risk of exposure, teachers and school staff, people of all ages with comorbid and underlying conditions that put them at moderately higher risk, all older adults, and those are over 65, that weren't included in phase 1, people in homeless shelters or group homes for individuals with physical or mental disabilities, and people in prisons, jails, detention centers, and similar facilities and staff who work in such settings. That's phase 2. Phase 3 would be young adults, and you may wonder why young adults are right there. The main driver currently of coronavirus within the United States and around the world is young adults. Those are people who are still congregating together, people who hang out in groups and may not in fact show many symptoms of coronavirus or get very sick on the whole. They actually are the ones keeping spread going. So we do want to focus on young adults in phase 3. Children, obviously, because they're in the school environment, and then workers in industries essential to functioning of society and at increased risk of exposure, not included in either phase 1 or phase 2. And then phase 4 will be everyone else. And again, these phases aren't intended to prioritize one person over another. It is intended to allocate very limited vaccine. Obviously, if we had all the vaccine we wanted right up front, we would just say, everybody come get it. But when you have a limited resource at the beginning, you really do have to prioritize it for those people who are seen as either most at risk for acquiring it, frontline healthcare workers, or most likely to get a severe outcome if they were to get it. Next slide, please. I see that there is at least one question in the chat box. I'll finish my short presentation, and then I'll go to questions. Vaccine accountability. As I mentioned, these vaccines are going to be complicated. There are many of them. They have different indications. Fortunately, in the state of Louisiana, we have one of the best immunization registries in the country. This documents who you are and what vaccines you have and need, and it even provides the option for reminder recall, either by telephone or postcard, so that we can remind people not only that they need to get a second dose of vaccine, but also what type of vaccine they need to get. So this is one, fortunately, in terms of vaccine accountability, that we're really proud of. We do have a great immunization registry. Next slide, please. So who normally gives out vaccine? VFC for vaccines for children providers, hospitals, doctors, pharmacists. Many people know that when they drive by a drugstore or grocery store within the state of Louisiana, your pharmacist can give you a flu shot. They will also be able to give you a coronavirus vaccine. Public health units, school-based health centers, federally qualified health centers. But then in the state of Louisiana, we do have several mass vaccinator partners. And what those are is the bus that drives up to your work or your children's school and will offer flu shots. Those mobile vaccinating teams, we've already been in lots of discussions with them to provide that service for COVID-19 vaccine. We're also recruiting new providers. EMS personnel in the state of Louisiana currently do not give vaccines. We're expanding their Practice Act to make sure that they're able to give COVID-19 vaccines. And then within the Vaccine Action Collaborative, what we're doing is we're also reaching out to non-traditional partners who may not give vaccines very often. Say, for example, an OBGYN provider. We are now learning that COVID-19 does have a higher risk of complications in pregnant women and would want to offer that COVID-19 vaccine to pregnant women. We're reaching out to providers like that to make sure that we communicate with them, we identify whether they want to be a vaccinator or not, making sure they're registered for the system, credentialed to provide that service, and training them to not only be a vaccinator, but to use the electronic system as well. Next slide, please. So COVID-19 vaccine administration, there's a saying that we have in immunization. This is actually the easy part. It's not the vaccine, it's the vaccination. It's just a simple vaccine like you get your flu shot or other vaccine. Again, we're going to have traditional providers, non-traditional providers, point of dispensing sites, and those are those mass vaccination sites either at your workplace or even for the general public. And then there will be direct vaccination administration. Nursing homes provide vaccine, influenza vaccine, and other senior citizen vaccines to their population all the time. We would expect that process to be absolutely no different using COVID-19 vaccine. Next slide, please. So you can imagine communications is certainly one of the biggest challenges with COVID-19 vaccine. There have been several studies out, including one in the state of Louisiana, that less than 30% of people would rush out, at the current time, rush out and get a coronavirus vaccine at this point. There's a lot of work that needs to be done both on that safety and accountability end that I talked about at the beginning of the presentation. I think people really do need to be educated using scientific information about the safety of the vaccine, the efficacy of the vaccine, how well it works. But once those things are known, we do have a plan in place to help communicate that information to multiple different groups of people. Most people don't realize that the main reason someone would get a vaccine is because their doctor told them that would be a good idea. So we have a large media and outreach campaign to educate doctors on that scientific information about the safety of any coronavirus vaccine. Also our stakeholders. We do have critical community leaders, including that Coronavirus Health Equity Task Force, places like that, who can be those critical community leaders as well. And then obviously the public at large, making sure that they have the information they need to make that educated decision on whether to get a coronavirus vaccine. We do have we got a grant in the state of Louisiana to help promote the coronavirus vaccine in print media, posters, radio, television, and bus ads as well. Next slide, please. So health equity in coronavirus vaccine distribution is really important, all the way from our governor, all the way to our secretary, all the way down. Again, we are inclusive in our Vaccine Action Collaborative and have included members of the Health Equity Task Force in every single group. We have members from the Immunization Program, Office of Community Partnership and Health, Board of Pharmacy, Government Office of Indian Affairs, and the Office of Community Preparedness. We also have multiple representation from universities, Louisiana Public Health Institute, the Nurses Association, ambulance drivers, Ochsner, other stakeholders, and then an extensive list who work in community groups, local community collaborative groups, to help make sure that their input is accepted in this collaborative. All work groups to include health equity in their work. We are going to trying to ensure that we reach all populations and provide access to vaccination regardless of barriers. Communication and outreach. We are going to have a series of regional town halls to educate various populations on the COVID vaccine, working with community and religious leaders to identify and reach marginalized or less accessible communities. In our logistics and operations, if we do identify that there are areas or places where people are not getting the vaccine or don't have access to the vaccine, we are going to deploy mobile strike teams and possibly buses to those locations to make sure that everyone has access to that. And then transport and storage plan for rural nursing homes with limited capabilities as well. Again, our planning includes over 30 organizations to ensure a variety of groups are represented and involved in creating the COVID playbook. The COVID playbook is what we're submitting to the CDC as our plan for the receipt, allocation, and distribution and administration of COVID vaccine. And then in the prioritization and allocation subgroup, making sure we develop logistical plans to create temporary vaccination clinics to reach those priority populations that we identify are not receiving the vaccine. Next slide, please. So there are a couple things we don't know yet, and this is the unfortunate part of this presentation. We initially expected, many people heard, we're going to get a vaccine by the fall. I don't think that's going to happen. It's certainly not going to happen in any significant amount. We don't currently know when we will get a vaccine, what vaccine we will get, the schedule for any vaccine, meaning is there a delay between the vaccine? Are the vaccines interchangeable, although I don't think they will be? We do not know the exact storage and handling of any particular vaccine. We don't know the minimum quantity, meaning can we ship a quantity of 100 or you have to do 1,000 in these initial doses? The indications for each vaccine, meaning who you can actually give each of these vaccines to. And we also don't know the interval between vaccination and protection. And what I mean by that is after you get that second shot, when can we consider you protected against the vaccine? So, and all of this is because this is a new vaccine being produced in the private sector, and we just don't have this information yet. Next slide, please. So we did get a supplement, the state of Louisiana got a supplemental award, and I wanted to make sure that you all were aware of this. We have done multiple things with this additional money, including that communication campaign. We're going to fund, we have 2 people working on social media marketing campaigns. We have hired the LSU National Center for Biomedical Research and Training to do tabletop exercises with us. We have enhanced our immunization registry to make sure that we are ready for this vaccine. We have an extensive communication and outreach campaign. And then again, I talked about those mobile outreach teams. We're going to make 6 to 7 vendors with those buses help us in those underserved communities. Next slide, please. So we do have some strengths, even though we don't know much right now about any potential vaccine. In Louisiana, we do have some strengths when it comes to doing a vaccination campaign like this. Not only have the Vaccine Action Collaborative been planning since June, our campaign will be based on strong communication and strong partnerships. We do have incredibly strong partnerships with academic association, government, and the private sector. The Office of Public Health does conduct a mass vaccination exercise either once or twice a year. Many of you might have participated in this in the past. In fact, we're going to conduct another one in about 2 weeks where we open almost every single public health unit in the state of Louisiana for an entire day and give out no-cost flu vaccine during that day. That's going to happen in about 2 weeks. The thing about this year, it's going to be all with social distancing. The vast majority of these clinics at every single public health unit will be a drive-up clinic, and you will drive up with your paperwork and get a flu vaccine. In planning for the distribution of coronavirus vaccine, we do those mass vaccination exercises not just as a public health unit, but we invite many of our partners in academia, emergency response, the private sector to help us with those vaccination campaigns as well. We have an excellent immunization registry system, and also our pre-planning has been built on years of pandemic planning. State of Louisiana has a pandemic influenza plan we have for about 18 years. We exercised that campaign in a real-world situation in 2009, 2010 with H1N1. Next slide, please. So the next steps, we're going to continue to work daily with the CDC and HHS. We have a standing call with our CDC and White House partners every single week to talk about the vaccination campaign. We will continue to plan and work within the Vaccine Action Collaborative at each step of the process. We are going to communicate with outreach to our stakeholders at every single step. We are going to prepare for our first doses of vaccine to be delivered November 1st, 2020. This has not been communicated to us, and unfortunately, we got some news in the past couple of days that November 1st date is probably not going to hold true. However, we as a Vaccine Action Collaborative are going to be prepared to receive that vaccine November 1st. We're going to continue to evaluate and improve the process as we move forward during the campaign, and again, communicate at every step. Next slide. I think that's my last slide. I do see that I got a question from Jade.
Yes, thank you, Dr. Welch. So I actually have 2 questions. The first is probably a simple question that you may have addressed, but I may have missed it in the presentation. And so my first question is, do we know what type of vaccination this will be? And this is, I'm not a medical person at all, but is this expected to be a vaccination where we have to take this every year, like we take a flu shot? Or is this more along the lines of the vaccinations you get as a child, where you get a certain series of them and then you're done? That's my first question. And then I know you're in a rush, so I want to get both of them out. The second question, you talked extensively about underserved communities and how your plan for distributing the vaccination to those, communities and getting it out there. I've seen a lot of information about the difficulties around getting participation in trials, particularly from the African American community. And that has been one of my priorities in service on this commission. Have those circumstances improved, number one? And then number two, given just the history, the lack of trust, just the lack of knowledge and communication as it relates to the Black community with these types of issues, right? We can talk about Tuskegee and all kinds of historical things. What is our plan for that? And so I just wanted to get your thoughts on that. I'm sure that that's something that the Health Equity Task Force has talked about, but I'm not sure. I'm not in those conversations.
Absolutely, and thank you for those questions. The problem with coronavirus is when it reared its ugly head. Remember that our first case of coronavirus actually March 6th in Louisiana. Just think about how recently that was. So there is a lot we do not know about coronavirus, including when you get the vaccine, how long does your immunity last? How long is it going to stick around for? If you want my personal prediction, though, I think there's going to be these first doses of vaccine, and then at least for a couple of years, it might be annual, like the flu shot. And that's just my initial thinking about it. Coronaviruses, most people don't realize, the common cold. There are 5 coronaviruses that circulate the globe and cause the common cold every single year. So coronavirus is actually quite common. And there is a coronavirus vaccine for dogs, interestingly, but not for humans. We always say, can you cure the common cold? Well, this is our first attempt to really cure the common cold, because I do not think coronavirus, it's shown itself to be way too powerful, way too infectious. It waits for us to get lazy and tired and bored, and it's going to sneak in. So I think coronavirus is going to be around for a little while. So I do think that there probably will be at least booster shots for a couple years. On your second point, everything you articulated is absolutely true and continues to be true. We formed a partnership about a month ago, the Vaccine Action Collaborative, with the Health Equity Task Force. And there are multiple members on that task force, not only trying to encourage minority inclusion in clinical trials. There's a special outreach that they're doing right now, but also to make sure that within the Vaccine Action Collaborative that we're collecting the correct data so that we know when there is a subpopulation of people who are not getting the vaccine. We can use some of that communication money, the expertise within the Health Equity Task Force. Those are some of the most important leaders in Louisiana. And when someone is going to take a vaccine, they want a trusted source. They typically, I'm going to use myself as an example. I've worked in government for about 25 years. So you have to be careful when showing a government official to not be the same guy who told you about flu vaccine and tetanus vaccine. And so we're working with the Health Equity Task Force to identify those trusted community leaders, not only within that task force, but within the faith-based community, and then also neighborhood communities as well, and making sure that we're not at the point where we really understand why someone would choose or not choose to get a vaccine, in particular for coronavirus, if you are in one of these subpopulations. But the Health Equity Task Force is working with us to help identify that. And then what my job is going to be is, once we identify those communities, we're going to get those trusted leaders out there to speak to those communities. We're going to get several leaders within that community to get the vaccine, because that's important as well. And then I'm going to send a van there or a bus there and make sure that those people who do want the vaccine are able to get it. Just remember, in the state of Louisiana, I think sometimes it's confusing. No one is required to get a vaccine in the state of Louisiana. You can always exempt yourself. Just know that it will always, we do not plan to change that. But what we want to do is that heavy communication campaign through trusted leaders and trusted sources to encourage people to do it.
Frank, hi, this is Terry Sterling. Thank you. I have a follow-up question because I actually joined your presentation with the Health Equity Task Force. Can you brief this group on the concern that the experts on the Health Equity Task Force have about the problematic sample size of Latinx and people of color in the vaccine trials?
Absolutely. And Jade, I can't see your last name or your title, and I just want to refer back, so I'm going to call you Jade, and I apologize if, okay. Just, exactly what you both are pointing out. There seems to be a very limited participation in phase 3 clinical trials. Just to back it up just a tiny bit for anyone who doesn't know, phase 1 is when they take a limited group of people, inject it in you, and did you fall over or something? Just did you accept the vaccine? Phase 2 is where they inject you with a vaccine, and then they check your immune system about a month later and say, do you have antibodies to it? Phase 3 means they take a whole bunch more people, and kind of the standard size is about 20,000 to 40,000 people. And they give 40,000 people this vaccine, and they say, not only did it work, is it efficacious? Is it preventing people from getting the coronavirus vaccine? But does it kind of represent people as a whole? And you can imagine that our communities look very, very diverse. So, for example, if you're only giving it to 20,000 healthcare workers, that looks different than a population in downtown New Orleans or downtown Shreveport or something like that, or rural Louisiana. So in phase 3 trials, what you really try and do is get a broad grouping of younger people, older people, Latins, African Americans, white people, some people with comorbid conditions, some people are perfectly healthy. And that phase 3 trials with the 30,000 people kind of tells you, of all these people we gave the vaccine to, those people did a lot better and got coronavirus a lot less than the people who didn't. And one of the challenges with the phase 3 clinical trials is they're just not getting that minority inclusion within the phase 3 trials. And the Vaccine Health Equity Task Force was very concerned, understandably, about that. And as part of their charge, they're kind of figuring out, in order to get somebody to get that vaccine or participate in the phase 3 clinical trials, you have to have that trust that the vaccine is safe, that it's going to do what it says it's going to do. And I think in today's climate, that's hard to get. We're even a couple steps behind. So their concerns are valid, and we're trying to address those in Louisiana, although I think it's a slow road.
Thank you.
And I haven't gotten an announcement for my next call. So if anyone had an additional question, I think I have a couple minutes still.
This is Commissioner Strain. Can you hear me?
I sure can.
Thank you. With flu vaccines and other things, our department provides the cold storage for that. Have you looked at the logistics that we're going to, and how many cubic feet of cold storage we're going to need and when, and made those arrangements?
I think we have a meeting with you Tuesday.
Good.
but thank you for that. And the interesting thing that Commissioner Strain brings out is there is one of these vaccines candidates that requires what they call the ultra cold chain, which is on dry ice, which is a very, very difficult thing to do logistically when you're trying to get that vaccine to communities. To thaw it, then once you do get the vaccine on dry ice, then you have to unpack it and mix it, and then you have to use it within some random amount of time that we have in 8 hours or 16 hours. So we really do need partners like Commissioner Strain to be on board.
Checking. Yes, thank you.
Yeah, and thank you for bringing that up. I think we're meeting with you all on Tuesday.
Okay, thank you.
Andrew and Don, I think that's it, and I'm happy to be here, and I would be more than happy to move forward and present to you in the future.
Thank you so much, Dr. Welch.
Thank
you, everyone.
Dr. Welch. Very informative and very comprehensive presentation, greatly appreciated by this entire Resilient Louisiana Commission that has got representatives from a broad cross section of Louisiana. So this is very, very helpful to our understanding and appreciation of the tremendous task that lies ahead.
I'd
Terry,
be glad to come back once we know a little more as well.
really good. Terry, anything else to add?
No, not at all. Thank you, Dr. Welch. Wonderful presentation. I think we would welcome at the point that we believe that we know we're going to receive vaccine to understand the distribution priorities. But we trust that we have a great team and your expertise, and we're thankful.
Thank you, and thank you for having me.
Great job. Thank you. So we will now pivot to the next topic for the commission today. One of the things that we wanted to do with the backdrop of the special session ongoing right now was to get just an overview of some of those particular activities. So invited onto the call today, the Governor's Director of Legislative Affairs, Mr. Adam Ettman, also Assistant Secretary Luke Morris from Department of Revenue, and also Assistant Secretary Mandy Mitchell from Louisiana Economic Development. So let's take them in that order. Adam, would you like to lead? You're on mute. Oh, there you go.
Yeah, sure. Thank you, Mr. Co-Chairman Pearson and Co-Chair Sterling. I really appreciate you all having me on today. I apologize. I'm really busy. The House of Representatives went in about an hour ago, and they are hearing a slate of bills today that deal with emergency powers and several other issues. So I just wanted to cover a couple of things, and I think Mandy's going to cover some other bills, and Luke's going to cover some of the tax bills. But there are a wide slate of bills that would amend and change the way that emergencies and public health emergencies and other like natural disaster emergencies would be handled in the state. Most of these reduce the ability of the governor to manage to manage these, and a lot of them interject the legislature into the renewal. There's a lot of discussion around renewals and how that's done after 30 days. There are also several suspension resolutions too that just passed off of the House floor actually that would suspend some of the emergency laws, meaning that the legislature has the ability to suspend a law for up to 1 year. And so these vary in different lengths and times. I believe the speaker's was a 30-day suspension of those provisions within the law that allow the governor to declare an emergency. There are also another type of bills that we're watching, or some that kind of tie the ability of the administration to specifically tailor response. And like an example of one bill would be a bill that requires that restaurants and bars are treated the same during a public health emergency. And I would say it's important to note that this isn't just a change that deals with the current pandemic or the current public health emergency, but it deals with all public health emergencies moving forward. Bars and restaurants are treated different in the law. They're treated different in regulation and how they're treated by the Department of Health, by the Office of Alcohol Tobacco Control. So that would remain problematic. It's the governor's belief that we can't manage an emergency by committee, and he is not going to cede his ability as an executive to manage and respond to an emergent threat of the health and safety of the people of the state to the legislature. That being said, we're working with legislative leadership to try to reach a place where they feel comfortable and where they can have more of a seat at the table as we move forward through what has been a long-lasting situation. So that's kind of a broad overview of where we are on those bills. And so we just the governor is trying to work through this with legislative leadership and others as we move forward.
Thank you, Adam. Assistant Secretary Luke Morris.
Hi, good morning. This is Luke Morris, and like Secretary Pearson said, I'm the Assistant Secretary for the Department of Revenue under Secretary Kimberly Lewis Robinson. I just wanted to touch base really briefly on a few of the tax legislative proposals that have been filed in the special session. But before I jump into that, I did want to mention in the prior sessions, both the 2020 regular as well as the first extraordinary session, there were various bills that were enacted that provided different levels of COVID-19 related relief, as well as I'm sure most of you are familiar with the bills that created the Main Street Recovery Program, the Frontline Worker Rebate Program. So at least at the outset of the, in these earlier sessions at the outset of the pandemic, there were various levels of relief granted through the legislative process. Here in this second extraordinary session, we have the legislative call is very, very broad in the sense that it basically puts all types of fiscal matters on the table. So everything from tax exemptions, exclusions, abatements, deferments, across the board, tailored to those providing relief for businesses that have been impacted. But just a few of those, I think the more important ones, I just wanted to brief you on. So, and also to make the point that this relief would apply across the board to all businesses. It's not necessarily tailored to requiring that a business had to be impacted by a hurricane or by COVID specifically. It's just more in a general sense. So that is something that we're working with the authors on to see if they could tailor those bills to be more of a specific direct relief to the impacted businesses. One that we, and of course, all of these, I suppose, it's important to note that when the legislature creates any type of new tax incentive or tax cut, that is $1 less of tax revenue that's collected, which would be $1 foregone for the public services that the state is required to provide across all levels of government, including things like the COVID pandemic response. But to that end, we do have a few bills. Senate Bill 3, for example, would reduce the sales tax exemption for business utilities. This has changed from time to time over the last several years. Currently, business utilities are taxed at a 2% sales tax rate, whereas most other businesses will pay a full 4.45%. But that bill carries with it an $84 million price tag for the period of November 1st to June 30th, 2021. So while it does aim to provide that relief, there are concerns that when you put a $84 million deficiency in the budget, that has to be made up in other areas. A few of the other bills, House Bill 5, which provides an income tax credit for the installation of certain broadband equipment, while certainly that is there's an important public policy behind providing internet access across all of rural Louisiana. This particular bill does carry its own $50 million price tag and would be in addition to a sales tax rebate bill that was also passed in the earlier session. There's another bill, House Bill 29, which would provide a severance tax suspension. So severance tax is the tax that applies whenever a tree is cut or oil is extracted from below the surface. And with that level of suspension, you would see approximately $36 million a year in revenue reduction. So while we certainly are mindful that the oil and gas companies are facing unprecedented times, to reduce the tax obligations there would then further pass along those deficiencies to the state coffers and their revenue influx. And then the final bill I wanted to mention was Senate Bill 9, which provides a sales tax exemption on construction materials, which aims to provide relief to businesses that are rebuilding post-Hurricane Laura. But like I said, we're working with the authors to try to tailor this to more of the businesses that have specific impacts. Because at this bill, initial projections of the Hurricane Laura losses are between 4 and 13 billion, and to exempt the sales tax on construction repairs, you could look at, just an average could be well into the hundreds of millions of dollars. So that is some of the bills that are on the table that are being considered now. We also have a few items that the department is working with other members on. We are looking at Hurricane Laura relief specifically for individuals who have losses that they are claiming for federal tax purposes. We're ensuring that there's no additional state tax that would come due on that, as well as we're looking into some legislation that had been filed in previous sessions, but we think it now more important than ever to address the issue of misclassification of independent contractors in the state. So when a business hires an employee, but they classify them as an independent contractor, certainly it benefits them in that they don't have to pay their state withholding tax or the unemployment insurance tax. Whereas, although that is not the acceptable approach to that, if a person is an employee, must be treated as such. So we're looking at ways that the Department of Revenue can detect this type of misclassification fraud and address it, and to the end of several benefits that would occur at the state level, including having those additional funds flow into the unemployment insurance trust fund that would otherwise have been due, but for the employer intentionally misclassifying its workforce. So we will be monitoring the session throughout the next less than 30 days now, but those are just a few sample of the items that we are closely monitoring. And I think that covers it for me. Thank you.
Thank you, Assistant Secretary Morris. Over to you, Assistant Secretary Mandy Mitchell.
Good morning, everyone, and good to be here today. And LED is also tracking a number of items this legislative session that impact business and industry, and also economic development and workforce development. We are keeping a close eye on a number of things, some of which has already been covered by Luke, so I won't belabor the point on those, but I do know that of particular interest to the RLC is broadband. And so there is the bill pertaining to the incentive for those that bid in the Rural Digital Opportunity Fund auction. But it does have a fiscal note along with it that's substantial. And then there's also a resolution creating a task force to study the 4.9 gigahertz spectrum. And that's about really trying to help expand rural internet service. So again, just touching upon broadband. And then jumping back to pandemic related legislation that impacts business, there's a proposal for business interruption tax credit that has been discussed already today, but also a proposal to standardize the form that businesses use to indicate to their patrons the measures that they are taking to protect public health and safety. That bill has not moved throughout the process yet, but it's something I am keeping an eye on behalf of LED. Hurricane Laura related, Senator Johns has a bill that's moving through the process to expand the New Markets Tax Credit program to include recovery zones or businesses in those zones impacted by Hurricane Laura. That bill has passed, completed its process through the Senate and heads over to the House. And then also pertaining to Hurricane Laura, Senator Fields has a proposal for the community and technical college system to work with Zoella to study the impact of Hurricane Laura, both from an infrastructure standpoint and from the human factor standpoint, and curriculum, et cetera, to study the impact on Zoella and its students, and to have a report prepared in that regard. Also, from workforce standpoint, there's a proposal to allow TOPS and GO grants to be used that first summer after high school is completed, when students complete high school and are awaiting their time to begin college. And then there's the Representative McFarland has a proposal to create a agriculture workforce development program. And I saw my friend Commissioner Strain on this call. He may want to discuss that piece of legislation, but it's something that we will be keeping a close eye on, as it could benefit agribusiness and the agriculture community, but definitely taking keeping a close eye on that legislation. And then pertaining to LED related programming, the regional economic development organizations, we have been working with them on a very broader, comprehensive, targeted strategy for marketing and recruitment in the space of reshoring. bringing those companies back, bringing those operations back to the states and preferably to Louisiana. And we, as we all became acutely and keenly aware of issues with supply chains for personal protective equipment during the height of the pandemic. And so you did see some interest at the national level and among various states in going after companies for reshoring purposes. But what the department learned in the last couple of days is that the regional economic development organizations are advocating for a reshoring incentive, an incentive specific to trying to lure those companies back to the states, and again, preferably to Louisiana. So we will be studying that piece of legislation. LED will be studying that and making sure that we weigh the balance of the cost or the impact of the incentive, along with all of the other measures that we are going to have in place through our comprehensive approach to reshoring. So that concludes my report, Secretary Pearson.
Thank you all each for your participation today and the great work you do for us as you manage the challenges that are out there. I'll see that our hour is rapidly past now, but we still have some ground to cover. So thank you that. Would like to ask Secretary Robinson to make a few remarks here. I think there's been an initiative by one of our task force to help guide the activation of the ability to execute festivals in Louisiana. It was really the pilot case, I think, came to us from the Renaissance Fair over in Tangipahoa Parish, and working closely with the Department of Health and Hospitals and others have got a framework established. But Secretary Robinson, could you comment on that and just sort of bring some awareness to the RLC members here, please?
Good morning, and thank you very much, Secretary Pearson. So, oh, and I'm sorry, I have the legislature on. I need to mute that. The task force, the Tourism and Travel Task Force, chaired by Kyle France and Jill Kidder, have been working with various parts of their constituency on requests that were submitted to the fire marshal. And what we've asked them to do is consider general guidance that could be provided to both fairs, festivals, other tourist events that would be happening in our state during this time of the year, as the weather outside is wonderful. It's sunny and 75 degrees. So this is definitely fair and festival season, as well as camps and campgrounds and all of those things. So they have been submitting requests to the fire marshal and working with the fire marshal's office and the Department of Health and their subcommittees on fairs and festivals and parades and all of that have been working to come up with guidance that can be put out through the RLC, as is our normal process, to update the public on how to open safely these different events during phase 3 of the road to resilience. So Kyle and Jill have been working to get that information out, provide that guidance, and I think we're trying to schedule a conference call with the camp and campground group for the next week, so we can go through their information. There is a pending request from the, I think, Cajun Rides, which provides some of the rides that a lot of the different fairs and festivals have. And we also have the Renaissance Festival has submitted their requests. So they are working with LDH and the fire marshal to make sure that the guidance that goes out is the safe and effective way to allow these events to happen in our COVID world. And I think we all heard the update from Dr. Welch that we won't start vaccines November 1st, more likely into 2021 before those are available to the general public. So we will continue to do our part to wear masks and be socially distant and try to have some of our normal fall events in the safest way possible. So thank you to those two co-chairs and the members of that task force for their guidance and attempts at making sure that we can have some of the things that we enjoy in Louisiana.
Thank you for that report out, Secretary Robinson, and sharing that information with the commission so that we build that awareness of some of the ongoing activities that continue to be important elements of what RLC is bringing to the table. With that, in just a minute, I'll call on my co-chair, Terry Sterling. But the other agenda item we had was just to sort of update the commission relative to the status of the Charge 2 working draft that's remains under production. We submitted that to the full commission for their initial review to secure any edits or comments to incorporate. What that turned out to be was sort of a time frame that coincided with Hurricane Laura in that it was mid-September. And really, I know a number of the professionals and leaders on RLC were taxed in terms of having time available to review the document. So over the last 10 days, we've kind of had the ability to start to engage again in sort of a final polish of the working draft. My co-chair has been a leader in that effort, and we're gaining ground on it. So hope to have a product out as a draft for the full commission's review. And we'll get to a point of being able to adopt that draft in the near future. But Terry may have some additional comments that she'd like to make at this time.
I know, Don, I think you've covered it nicely. I think the document is about 80% there, and the work group that's working is doing an exceptional job. We'll get together once or twice next week, and I think have something that the commission will be proud of. Thank you.
And that process is not designed to be exclusive. If there's commissioners that want to be full participants in that, please know that we're just looking for those that want to roll up their sleeves and spend a few more hours on this. So with that, I know everybody here has contributed very significantly, and that is again greatly appreciated. At this time, I think that concludes our formal agenda for today. If there are comments from the commission, if there are comments from the public or any other business, we could entertain that now.
There's been nothing coming through YouTube or through the Resilient Louisiana email from the public.
All right, hearing no additional comments, then we'll entertain a motion to adjourn.
So moved.
Moved by co-chair Terry Sterling,
I'll
seconded by Ms. Martin. And all in favor, please indicate by saying aye or wave your hand.
Aye.
Okay. Thank you, everybody, for your time today. I thought that was a very impressive and informative report from Dr. Welch. We're trying to bring to you pertinent information to keep you informed as commissioners and continue our important work here. So thank you for your time and attention today.
Thank you, Mr. Secretary.
Meeting adjourned.